Greetings. My name is Dr. Waddell Brooks, Sr., your host, and this is Community Focus. We're very fortunate this morning to have with us an exemplary person, Mr. Antonio Beltron. He's Executive Director of the Lake County Health Department Community Health Center here in Lake County. Good morning, Mr. Beltron.
Good morning, Dr. Brooks.
Ladies and gentlemen, Lake County is responsible. They have a motto of what healthy people, healthy choices, a healthy Lake County. And we're going to learn all about that in just a few seconds. But we want to welcome Mr. Beltron with us to Lake County. Is approximately 750,000 people. But Tony, I don't know how many up at 5 o'clock this Sunday morning listening to the program, but I understand we have a pretty good audience. And I want to thank right now our my special person at the studio, Mr. Chris Williams. I give him a title of a program manager. Is that right, Chris?
Sure.
He'll accept that program manager for probably the 10 or 15 years here, and that responsible for the program. We also have a contact person here, Leslie Piotrowski. She's a communications manager for the Lake County Health Department. So we're surrounded by a great resource people to make this program go. Tony, I would like for you, first of all, to tell our listening audience a little bit about your personal and professional background.
Great. Well, thank you, first of all, Dr. Brooks, for having me on the program. I'm really excited to be here. So I've been at the health department for about 2 years, but I've actually worked in healthcare for over 20 years. I started out my career at the University of Illinois Department of Family Medicine and worked there for quite a while. And later I transitioned to work with federally qualified health centers. And those health centers work with people that are uninsured or underinsured. Mm-hmm. So I've had the chance to work for the largest federally qualified health center in the country at the time, Access Community Health. But I also worked for a small local community health center as the chief operating officer, and we grew from 2 health centers to 7 while I was the COO. Right before I came to the Lake County Health Department, I served as the first deputy commissioner for the Chicago Department of Public Health. So public health really runs in my blood. And there I had the chance to participate in the development and implementation of Healthy Chicago, which was the first health-oriented strategic plan that the city had. I went to the University of Illinois at Chicago. I also have my MBA from Lake Forest Graduate School, but I was born in California and lived there for most of my childhood. My mother was in the military, so I had the luxury of moving a little bit. Okay. And for high school, I went to Highland Park High School. My mother was stationed on Fort Sheridan, so our whole family packed up. We lived here for a couple of years, but I decided I loved the Chicagoland area so much and stayed here. And as a resident of, a graduate of Highland Park High School, I'm really glad to be back in Lake County.
Ladies and gentlemen, again, we're talking with Tony Beltron. He's not new to Lake County, as you heard him. He's now the executive director of the Lake County Health Department Community Health Center. Tony, I would like to ask you why interest in public health. What determined your interest there?
So as I mentioned, I started working in healthcare, and I knew I wanted to be more on the administrative side of health. Okay. But really, I believe that health has such a profound impact on all aspects of our life. So if you're healthy, you're going to have a better health outcome. But really, from the standpoint of public health, it was really to address the issues that we all deal with. So healthy lifestyles and making sure that's the case. For some, it's dealing with health disparities and how do we improve the quality of life for all of us together. And really, public health takes all of those aspects into consideration. So it's one of the areas I think is most important and one of the driving forces for my life.
So this motto, the Lake County Health Department has healthy people, healthy choices, and healthy Lake County. This was fit right in with your goals right there, right?
Yeah, luckily that motto was there before I came, but you're right, Dr. Brooks. It's exactly how I think about life.
This is fantastic. Well, why Lake County? Is it because of your love for the county? Do you want to get back here?
So one of the nice things about the health department in Lake County is we provide a broad range, of services. And so I'm really happy, as a department, we've been around since 1956, so we're not new to public health. The health department's been around. Okay. We have over 45 different programs that we manage and about 1,000 staff that work in the health department. So it's really comprehensive portion in terms of services that we provide. So some of the services are things that most people know they've come across in their lives. So maybe it's food protection. We do a lot in terms of restaurant inspections. We inspect over 3,000 restaurants every year, a couple of times a year. So we're able to really protect the quality of food in the county. We also regulate solid waste programs and closed landfills and others. We regulate things like beaches. But one of the programs most people know about from the standpoint of our department is the animal care and control. And I think, when people talk about their animals, they definitely love their pets as part of their family. So we're able to provide services for lost and found. We also track rabies vaccinations and offer low-cost pet vaccinations for individuals. So that's great. But in Lake County, one of the things that really drew me is the comprehensive direct services we provide, both to those that have behavioral health issues. We serve about 8,000 people with severe mental illness or substance abuse or coexisting. And then in our community health center, which is a federally qualified health center, we provide direct primary care services to over 40,000 residents in the county. So it was really that comprehensive nature of the Lake County Health Department that really drove me here. In addition, as a county, we're pretty diverse. So dealing with some of the health disparities that some of our communities that are a little more challenged was really one of the things I felt was important. So I came back to Lake County.
Well, North Chicago is very happy to have you here. And also they have the Lake County Health Department has a community health center there in recent years. And I noticed in traveling to Zion, there's one there. So you reach it out over Lake County, placing your community health centers.
We do. So our community health centers are Joint Commission certified. So we're high quality health care. And we have 8 health centers throughout the county. Okay. 6 of them are full access, and then 2 of those health centers serve specific community partners. But you're right. We try to be broad in terms of providing services within our community primary care health centers.
Mm-hmm. But tell us, I'm sure you have priorities. What are your priorities as a health department director?
So there were a couple of priorities. The first thing I wanted to do when I came here was work on the strategic plan for the department and the county. And we were lucky that we had a community health improvement plan that process had started with a lot of community involvement right before I came. And so for our internal community plan, we really built on that, the plan that the Lake County community already had. Mm-hmm. And really set those goals and tried to work on them. And so our current plan goes from 2013 to 2016. But in the last couple of years, we've seen a lot of progress on those. So one example is we had planned, we manage wells, and we had planned to seal 100 abandoned wells to protect individuals from that. And so the goal was by 2016 to complete all of those. We're ahead of schedule so far. We've been able to seal 78, so we think we'll definitely hit that number. We also planned to reduce the number of opioid-related overdoses by 20%. As you may know, opiates are a big challenge, not only in Lake County, but nationally. Mm-hmm. And the number of individuals that are dying from this, unfortunately, continues to rise. In 2012, there were 46 people that had overdoses, and the number in 2013 went to 49. And so our goal was really to work with the community-based group that had started this. So the Lake County Opiate Prevention Task Force really focused on dealing with opioid use, abuse, misuse, addictions, as well as overdose and death. And as part of this initiative, we work to train law enforcement to be able to administer a medication called naloxone. And what that medicine does is if someone is going through an overdose, it allows the overdose to be reversed and fairly quickly. So within a minute or two, that person will feel the benefits. And without that, they most likely would die. And so the health department trained police officers, and we were lucky that our law enforcement was so progressive to try to train everyone. We trained a cohort of about 100, trained the trainers, and then they went out and trained the rest of the 3,000 law enforcement officers. Since December of last year, in fact, 18 people have been saved from opioid overdoses by law enforcement officers. And that really speaks to the work that already our other first responders were using naloxone. So this was a great advantage. One of the other things I really focus on is how do we reduce the barriers to care? And so we've done a couple of things. We established with many community partners a program called Enroll Lake County. As a health department, we led this initiative, but it was really a community-based initiative. We were able to get over $1 million in grants for the last 2 years to provide this service. And those community partners together were able to enroll people through the Affordable Care Act. So as of May of this year, over 42,000 people in Lake County have signed up for insurance. And of those, the Enroll Lake County initiative directly helped 19,000 sign up with that. So we're really happy. The last thing that was really a priority in terms of reducing barriers to care was our school-based health center. So last year we opened a school-based health center at Round Lake High School. It was actually a 5-year project that many community partners had done. So through funding from the Healthcare Foundation of Northern Lake County and collaborating particularly with the school district and other partners such as NACASA and Mano a Mano, we were able to open the first school-based health center in Lake County, and hopefully that will help improve the access for students in that area. So those are just a couple of priorities we're working on.
Mr. Beltron, in addition to providing health care to Lake County citizens, you're also interested in preventing illnesses too, right?
Definitely. So in public health, prevention is definitely one of the things that we focus on a lot, and we do prevention in lots of different ways. So prevention for us could be some of the work that we're doing right now, for example, in National Men's Health Month. So if you don't know, the leading cause of death for men is heart disease and cancer. And in many cases, those are, preventable. And so we focus on really trying to get awareness out there. We've had a couple of community events around this, but really improving the lifestyle. As men, sometimes we're not the best at taking care of ourselves in terms of prevention. We just go to the doctor when we are not feeling well. But what we're saying is there's a couple of things that men can do. So one of the things that we can do is increase the amount of sleep. So adults, we should get 7 to 9 hours of sleep each night. We should avoid not only tobacco ourselves, but secondhand smoke as well. And smoking is actually the leading cause of death. We should increase physical activity, so we should get 2.5 hours of physical activity every week.
It's not just moving around and going and paying bills and so forth. It should be concentrated exercise.
It should, yeah, exactly. It should be moderate, intensive aerobic exercise. So while you can't do all 150 minutes at one time, you should do it a couple of times. You can break it up into 10-minute segments. So we're all pretty busy, and so there's different ways to get to that. But definitely at least try to do that. And you can do other things like stretching, but you really want to use all the muscle groups. We should have, better diets, so eat more fruits and vegetables, and this is a perfect time with all the farmers markets. I encourage people to visit them, try a fruit or vegetable you've never tried before, and that's great. But also reduce things like high foods that are high in calories or salt or fat or even sugar. And then really managing our stress is another thing we should really, do through various activities. But most importantly, I think for us to remember is that men should have regular checkups with their primary care providers. So that's something we definitely want to focus on as well.
Environmental health programs are so important now, not only the businesses, but even individual homes should be checked out because it's very, very important, very serious, sir.
Yeah, definitely. We want to make sure that we're providing services through our environmental programs. And you're right, we want to do that through homes. So we actually help inspect some of the private wells that individuals have and do that program, or they can do it through one of the contractors and report back to us. But it's summertime, so our environmental programs are extremely busy right now. This is the busiest time of year for them. One of the programs that's really busy is our lake management. So they take samples of beach water at the beaches and try to test it for E. coli bacteria. So while the E. coli at low levels is not so bad, when it gets to high levels, that's when it can really be dangerous to people if we ingest that. So we test that in terms of the beaches. And if there is a high level, then we will close that beach until that gets under control. The other thing is we always think about rain as being bad during the summer months and this time of year, but I actually have maybe a different view. What rain means to me is it clears out the stagnant water where mosquitoes will breed, and we really are worried this time of year about West Nile virus. And so anytime, rain comes, it washes away kind of those breeding grounds for mosquitoes. And it's also a reminder to us, if you see any standing water, to get rid of it. And then, as I mentioned earlier, our animal care and control, they're very busy in the summer months. They have free or low-cost, vaccination clinics throughout the county. And so individuals can go there to get their rabies vaccines. They can also go there to have their pets microchipped. And our next event is actually August 15th at 9 o'clock at the Zion Park District. So anybody interested can, come to that location.
Well, this is very timely then, right? In addition to your environmental health programs, what about behavioral health programs?
Yeah, so behavioral health is one of the things we really want to focus on. How do we improve the life of individuals that are suffering from severe mental illness or those that have alcohol or drug addiction? So one of the main things that we do is we operate a crisis care program, and that program actually operates 24 hours a day, 7 days a week. So if someone is in an emergency crisis, we want to encourage them. They can call and speak to a counselor at any time. That phone number is 847-377-8088. But for those that are not in crisis, there's other ways to get services. So we have a couple of outpatient mental health centers in Waukegan and Libertyville where people can come in for counseling, psychiatric services, as well as therapy. We have addiction treatment programs as well. So not only do we work on the naloxone program with the law enforcement, we actually provide treatment. So we have an inpatient detox center which runs 24 hours and allows someone to get off of care in a safe off of drugs, in a safe environment. We operate a women's residential services program, and I'm always excited when I get a chance to go there because the strength that these women have to kind of beat their addiction and go through that is really inspiring. And then we offer other outpatient treatment programs as well for individuals that have substance abuse disorder.
You have a huge responsibility. Tell us about the budget of the health department.
So we've been pretty lucky to really try to go after lots of federal grants, state grants, as well as billing for all of the services that we provide. And so over the last couple of years, our department's budget has actually grown. So we're over a $70 million budget. And a lot of that is really to provide services to the residents of Lake County. So we're lucky. And that also employs about 1,000 individuals in the health department.
Yeah, that's my next area there with the number of employees. What about while we're at the employees? What about your cultural diversity staffing?
So we have a diversity and inclusion work group that actually focuses on that. And one of the things we really try to emphasize is, as residents come in, how are we really treating them with care that is both culturally as well as linguistically competent for that individual. And so they focus on making sure that we can provide care to individuals in that way, as well as really just arming ourselves with tools and education around cultural diversity. We're lucky Lake County is an extremely diverse community in many cases, and so we want to be able to meet the needs of our residents.
Mm-hmm. I noticed prior to your coming here, there was a female that was the executive director of the health department, so I'm sure there's be no problem about glass ceilings as far as women are concerned, you know. But other minorities, such as Asians and African Americans and Hispanics and so forth, I'm sure that you take a close look at that too, right?
We do. You know, we really look at what the needs of that area. And so it varies in different programs, especially in our direct services. We really want to make sure that we're meeting the needs of those clients, and in particular, the linguistic needs. So in what language they want care. In some cases for Spanish, we're able to provide it on site. In other cases, we have options to have translators for other languages where we may not have a person that speaks that language. But we always can try to, find a language that works for them. But definitely, I think we want our employees to really represent the communities that they're a part of.
Fantastic, yeah. Is there any special requirement to be bilingual, when you're hiring employees?
For some programs, we do require bilingual services, but not necessarily for the whole program, because the community, like I said, is pretty diverse. So we don't have any programs where everyone is required to be bilingual. But in many cases, what we do is we look at the individuals using the services and how many of them are monolingual, say in Spanish, and try to provide that service based on that need.
Ladies and gentlemen, again, we're talking with Antonio Beltron. He's the Executive Director, Lake County Health Department, Community Health Center, which is located on Grand Avenue. Is that, what's the exact?
So our main office is at 3010 Grand Avenue, but we have locations throughout the county. Okay,
fantastic. And we're very, very fortunate to have you come down for half an hour to talk with Lake County about the programs within the health department. But if anyone want to invite you to come be as a speaker, or are you available to do speaking engagements, or do you have a cadre of people to go out?
We have both. In some cases, I definitely can provide services and go out and speak. But in other cases, there's people much more qualified on specific topics. So we like to have others go out because they know a lot more details about their specific programs. So it really depends on what they want. But if they ever have a question where they want someone from the health department, they should just call us and we'll make sure that the best person to meet their needs is able to participate with them.
Mm-hmm. I really appreciate you. You're very eloquent and exec director. One of the, requirements, you have to be able to get the message across. And you say you have a Lake Forest management. You have a master's degree.
I did my MBA at Lake Forest Graduate School of Management.
Okay. So if anyone interested in applying or working for the health department, what are some of the requirements and what would they have to do to apply? When I was coming up, we had the pencil and paper, and but normally you don't apply that way for any job now, right? You have to go through the electronic process.
That's correct. So, the type of qualifications depends on the job, and with over 45 different types of programs, they really vary quite a bit. But what I would say to people is really go to the Lake County website, and that lists all of the jobs, not only in the health department, but in all of the areas. Okay. And it will help to guide what are the requirements for that particular job. And although they might think, well, I'm not sure if I would qualify to the health department, just look at the jobs and you'll be able to see, and the qualifications are pretty clearly delineated. And like I said, with that many different programs, we don't only provide healthcare in a clinic, we do lots of other things. So I encourage everyone to please look us up.
Long-range plans for the Lake County Health Department, say 5-10 years from now.
So really one of the things we focused on in our strategic plan was looking at some of the health disparities in certain areas. And so our goal is really to decrease the health disparities that come with negative birth outcomes, that come with diabetes or hypertension in certain communities. And so unfortunately, some of the communities where we have those, we're beginning to move the needle, but I would love to come back here 5 years. Hopefully I'll be invited back sooner, but even in 5 years, be able to say in these communities, here's where we were at, and here's where through lots of community involvement, we were able to decrease those health disparities and make sure that everyone had access to care.
Well, you definitely will be invited sooner, and we'd like to have you bring a progress report back, and I'm sure our Lake County citizens will be happy to. But anytime they have any questions or they have a phone number they can call or...
Sure. So the best thing to do is to call our main number, and that's 847-377-8000. Okay. And they'll be able to find, based on what the need is, they'll be able to make sure to get the person to the right program.
Mr. Beltron, tell us about a few of the challenges that you've had already at the health department.
So I always think of challenges as just opportunities and different ways to think about those. I think, the Affordable Care Act and enrollment was one of the items that could have been seen as a challenge, but for us, we took it as an opportunity to increase care to individuals. As I mentioned, we provide a lot of direct services. So in 2014, there was a conversion from straight Medicaid programs to what are called managed care plans. Most people will think of those as HMOs. So if I say managed care, it really is kind of an HMO, a managed plan. Okay. And for us, we went from about 1,000 people in those types of managed care plans to over 22,000 people that we care for in those plans. And there are 7 different ones. So for us, it was about making sure that we could provide the same level of service for all of those individuals, as well as making sure that from their standpoint, the care was as seamless as possible. So that was definitely one of the biggest challenges, that we've had. But I think overall for us, it's about improving the health and wellness of the 700,000+ individuals there. So we've been focusing a lot around some of our prevention programs, such as Tobacco-Free Lake County, our TB program, our communicable disease, really things that could impact anyone in the county.
Mr. Beltron, do you have any time for leisure time activities?
I do. I love to come visit. This last weekend, I was just in Ravinia, and I was able to see a great concert on Saturday night. So, I try to, enjoy. I like to work hard, but I also like to relax when I get a chance. Okay.
Any time for family life? You travel quite a bit then.
I have traveled. Yeah, I'm looking forward. I'm going to have a trip coming up later this year after the summer, and a lot of our busy time is done with budget. I'll be able to travel hopefully around September.
This is fantastic. Ladies and gentlemen, again, we've been talking with Tony Beltron. That's Antonio Beltron. He's the Executive Director of Lake County Health Department Community Health Center, and he's been sharing with us. He's been promulgating information concerning the Lake County Health Department Community Health Center, where the motto is healthy people, healthy choices, healthy living. If you want more information about the Lake County Health Department, you may call 847-377-8055 or go to the website.
Yeah, our website has a lot of information as well, so please visit us on the web.
And give your website.
So our website is www.lakecountyil.gov/health.
Fantastic. Ladies and gentlemen, you've had it We want to thank you for taking time for listening to another awareness session on community focus. My name is Dr. Waddell Brooks Sr., your host.